labels on their medications to reduce the risk of accidental overdose and allergic reactions.
The new labelling rules on all prescription drugs will come into effect this month. The Health Minister, Sussan Ley, says current labelling can be confusing to some patients who may take too much or use it incorrectly.
They'll be much more readable, the writing will be bigger, the active ingredient will be underneath the brand name, they will alert you if there's any allergens that could cause you problems, and they'll be consistent. So we know that people are often confused by their medicine labels, and the TGA has done a great job. They've spent nearly 5 years consulting to get this absolutely right and world's best practice. It's important to warn consumers about the allergens, but it's really important to educate consumers about the active ingredient in the medicine they're taking. So if they get used to just knowing a medicine by its brand name, and then they have to switch to a generic or the brand doesn't become available suddenly, it can be confusing for them. So underneath that brand name, we need the name of the active ingredient. A good example is paracetamol. It's the active ingredient in a lot of pain-relieving tablets, cold and flu tablets, etc. But you need to know that you're taking a certain amount of paracetamol, not, for example, the brand name, which might be Codral, might be a pharmacy brand, might be Panadol. If you're getting a dispensing label from your pharmacist, that dispensing label needs to be of a certain size. And if your pharmacist is alerting you to anything that you particularly need to know, we would expect that to be on that label. That's about readability. There's only so much you can fit on what is often a small medicine packet or bottle, but I see this as a really important step in educating consumers about the medicine they're taking and just readability.